So vital sign is before we mention there are four vital signs: respiratory rate, heart rate, blood pressure, and temperature. In this PowerPoint, we are going to focus about the blood pressure and we are going to trace out about the temperature, right? So first of all, the blood pressure. The normal blood pressure here is 110 to 120, it is systole, and 60 to 90, it is diastole, right? I'm not going to give too much discussion about this. What actually need for NCLEX board exam, we're just going to focus on it. So I said we have to know what are the normal blood pressure, what are the classification of blood pressure, like pre-hypertensive, stage 1, stage 2 hypertension, what is orthostatic hypotension, and also we have to discuss how to measure the blood pressure. Here you can see the blood pressure also fluctuate with the age group. In case of adult person, it is 120 to 130 systole over 80 to 84 is diastole. When the newborn or infant, the systolic blood pressure 90 over 55 millimeter of mercury. This is the unit, right? So now go for the classification of hypertension, right? So first of all, the normal, then pre-hypertension, stage 1 hypertension, stage 2 hypertension, and also isolated. So the normal, we said the systolic or systolic, it is more than or it should be more than 90 and less than 120, in between, right? Systolic. And diastolic is less than 80, basically. So when a patient come to you, definitely we have to count down the blood pressure several times. Then we can tell my patient is hypertensive. So before go hypertension, this is another terminology, is called pre-hypertension. When we tell our patient is pre-hypertension, when the systolic blood pressure more than 120 or more than 139, and diastole is if it's more than 89, right? And stage 1 hypertension, usually systolic blood pressure is in between 140 to 159 or 160. What about the diastolic pressure? It is less than 100 or 90 to 99. The stage 2 hypertension is systole is more than 160, but diastolic pressure should be less than 100, more than 100, right? Millimeter of mercury. So hypertension equal to the blood pressure reading elevated on 3 separate visits over the 7 weeks. So when a new patient came to the primary care unit at the first day, we can't say you are hypertensive. It is good reading, you take the blood pressure reading at least 3 separate visits over the 7 weeks. If persistently increase in every consequent visit, we can say they are hypertensive. So now let me go through a little bit about the measurement of blood pressure, right? So let me explain what is blood pressure first. So basically the blood pressure and the pressure by the blood over the arterial wall when blood is passing through the blood vessel. So blood pressure, sometimes NCLEX board asks, what is pulse pressure? The pulse pressure means the systolic blood pressure. If you minus the diastolic blood pressure from the systolic blood pressure, it is the pulse pressure. As an example, I said here a patient, the systolic blood pressure 120 and diastolic blood pressure 80. So what are the difference between systolic and diastolic blood pressure? And that is the pulse pressure, right? And then it is important during the measurement the blood pressure, using the appropriate cuff. So this is the blood pressure cuff, and this is the sphygmomanometer. Stethoscope, this is a diaphragm. So this is the different size of cuff in the picture. You can see this is for adult and this is for infant or newborn. So using the appropriate cuff, it is very important. So I said the blood pressure cuff usually affect the patient blood pressure measurement. If the blood pressure cuff is too large, get the falsely low reading. Too large, false low reading. If the blood pressure is too small, cuff is too small, get falsely high reading. So when it is large, low blood pressure. When it is the cuff is small, high blood pressure. So during the measurement of blood pressure, we have to keep some point in mind. So some key point when taking the blood pressure, like do not take the blood pressure in the arms if patient use the IV infusion running. So like this patient, if she has a IV line in the left hand, we never use left hand to measure the blood pressure. Also, do not take the blood pressure on site where the patient had a mastectomy or IV shunt or fistula, right? So to estimate the systolic blood pressure using auscultatory method, okay, and also palpate the radial pulse and inflect the cuff until the pulse disappear. And also we have to inflect the cuff another 30 millimeter high, and also release the pressure and note when the pulse is palpable again. So in our other class, I will explain how to or what are the technique to measure the blood pressure. And here I want to explain about one of the terminology related orthostatic hypotension. So orthostatic hypotension, you can see the picture. The lady, she was sitting on a chair and suddenly she stood up and her blood pressure dropped. So low blood pressure and also patient complain of lightheadedness when she changed her posture from sitting to standing. So this is orthostatic hypotension. So take the patient blood pressure in supine position. If the patient have this type of problem, it is good to take or measure the blood pressure in supine position. And also it is good to sit the patient. So the person who have this history, if you measure the blood pressure during the supine, blood pressure measured during sitting, and blood pressure measured during the standing, you will get different measurement. So sit the patient up and wait for 2 to 3 minutes. If patient has a history of orthostatic hypotension, it is good tell the patient to sitting, wait for 2 to 3 minutes and take the blood pressure. And during the standing position, stand the patient up and wait another 2 to 3 minutes and take the patient blood pressure in standing position, right? So here I said the person who have the orthostatic hypotension, they also complain of faintness or dizziness on rising from sitting to stand up, right? So if we know the patient have orthostatic hypotension, so usually the positive, what are the some positive signs for orthostatic hypotension, like systolic blood pressure decrease of more than 20 millimeter when change the position. So like supine, if you measure the blood pressure during supine and sitting, or from sitting to standing, every time systolic blood pressure should be decreased of more than 20 millimeter when change the position. Like here, the systolic blood pressure is 140 in lying position, lie down. But when sitting is 120, almost 20 millimeter of mercury gap. Same as when standing, it is 1/4. It is almost 20 millimeter gap, right? Let me recap it. I said the patient who is orthostatic hypotension, if we measure the blood pressure in 3 position, like lie down, sitting, or standing, every time systolic blood pressure decrease of more than 20 millimeter of mercury when changing position, and or diastolic blood pressure decrease of more than 10 millimeter of mercury with 10 to 20% increase the heart rate. And you know that when blood pressure go down, heart rate go up. Like here, the diastolic blood pressure 80 when supine. When sitting, it is 86, and it is, I mean, sorry, it is, I said, showing the pulse rate is 80, and pulse sitting 86 and standing 98. So pulse is increase or heart rate increase. and diastolic blood pressure is 80 when supine, 76 when sitting, and 68 when standing. So diastolic blood pressure decrease of more than 10 millimeter of mercury. So as a RN or LPN, what is our responsibilities? Nursing care. So assist with ambulation. We have to assist them during the changing the posture or have the patient sit at ease for 1 to 2 minutes before stand up. Like if I have a orthostatic hypotension, you are my RN, you has to advise me that during the changing or if I am lying down on the bed if I need to stand up, the patient have sit at the edge of the bed for 1 to 2 minutes before stand up or change the position very slowly. So next we have to talk about the temperature, right? The temperature also has an important vital sign. So first of all, I said what we has to talk about here. We should talk about the temperature expected range of temperature, right? So like oral, rectal, axillary, temporal, and also some of the factors that impact the body temperature we will be discussed is as well. And also we supposed to talk here the two terminology, hyperthermia and hypothermia. So basically when we need to measure the temperature, we have to use the two scale. One is Fahrenheit scale, other is Celsius scale. So temperature is measure of the thermal energy in the body. Normal measured in degrees, right? And what is Fahrenheit or Celsius? In this table, you can see the different measurement type, normal temperature range, and indicator for the fever. If you take the oral temperature, the oral temperature should be, normally it is 35.5 Celsius to 37.5 Celsius. And some books said it is 36.5 to 38.5. Okay. So oral temperature I'm talking about. So let me recap it. So oral temperature is normal, easy way to remember, 36 to 38 degrees Celsius, and average is 37 degrees Celsius. So if it is more than 37.5 Celsius, we said fever. What about the Fahrenheit? It is 95.5 to 99.5 degree Fahrenheit. In case of rectal, it is, I like to tell you the oral is standard, then compare contrast with others. Like the rectal is 0.5 degree higher than the oral. Okay. and it is usually rectors 36.6 to 38 degrees Celsius. In the axillary, it is also 0.5 degree lower than the oral temperature, and axillary it is 34.7 to 37.4. Okay, and some books say 35.5 to 37.5 degrees Celsius. In the tympanic is 0.5 degrees higher than oral, and average it is 35.7 to 37.8 degrees Celsius. There are some factors that impact the body temperature. There's some factor that impaired the body temperature, like newborn. So the newborn have lower temperature, right? So it's very important during the take care of the newborn, maintain their body temperature. So old adult have also lower temperature than the adult person. And things that increase the temperature are hormonal change, like menstruation, body temperature little bit increase, during ovulation, menopause, during exercise, dehydration or illness. Also, some food or fluid or smoking can impact the oral temperature. So if you want to take the oral temperature, make sure the patient or client did not to hot food or fluid or did not smoking at least 30 minutes before to take the oral temperature. So now I'm saying there are two terminology. One is hyperthermia and other is hypothermia. So temperature maintain is important for the patient. So during the hyperthermia, usually when over 39 degrees Celsius, so also we has to obtain the blood culture if patient have a hyperthermia. If patient have hyperthermia, admin antibiotic according to the blood culture or antipyretics like acetaminophen or aspirin. Also fluid is ordered at doctor orders. Also we has to prevent the shivering or provide the blanket if patient is having the chill. Let me read in this PowerPoint. Hypothermia means having the body temperature above the normal level. If your patient have the hyperthermia, how does the body cope with this? So tell your patient to take enough fluid or drink as prescribed or cool down the internal organs such as heart, liver, or brain. The other symptoms for hyperthermia are patient develops shivering or patient lack of coordination or difficult to speech, confusion, poor decision making, or very low energy, and body cells start to die if not treated. What about the hypothermia? Hypothermia when the temperature is under 35 degrees Celsius. And we have to provide, if patient have hypothermia, by first priority to provide the warm blanket and warm the IV fluid and increase the room temperature and also keep the head cover. And let me read this PowerPoint for you. So when the body temperature is below average, I said under 35 degrees Celsius, we called hypothermia. And how our body coping with this hypothermia? So move the person indoor or somewhere warm as soon as possible. Once the person is in a warm environment, and carefully remove any wet cloth or dry them, right? And also wrap up with a warm blanket or towel or coat and protecting their head and also body first. So what are the symptoms of hypothermia? Shivering, dizziness, hunger, because body produces energy, and faster the breathing, and confusion and increase the heart rate.